Hello and welcome to today's webinar. My name is Jane Smolnick. I'm a naturopathic doctor and iridologist, and I am one of the instructors for Souls Academy. Today's webinar is about seasonal affective disorder. What are the symptoms, what causes it, and what can I do? So what is SAD? SAD is seasonal affective disorder. It's a form of seasonal depression that can be triggered by a change in seasons, primarily in the wintertime with a lack of light. More than 500,000 Americans experience a winter depression but are better when the summer comes. It's believed that affective people react adversely to the decreased amounts of sunlight and the colder temperatures as the fall and winter progresses. It's important to treat S.A.D because all forms of depression limits people's abilities to live their lives to the fullest, to really enjoy their families, and to function well at work. Some things you should know. Seasonal affective disorder usually presents in the fall and winter, but there are also some who suffer this condition in the summer instead of or in addition to the fall and winter. Seasonal affective disorder has only been recognized since 1985. It's also called winter depression, winter blues, or the hibernation reaction. The incidence of seasonal affective disorder increases in people who are living further away from the equator, like in the northern hemispheres. In the United States, this disorder occurs in 1 to 10% of all adults, and its prevalence is dependent upon geographic location. It's less common where there's snow on the ground throughout the winter. It's also about 4 times more common in women than it is in men. And the average age of people when it develops is about 23 years of age. But people of all ages can develop seasonal affective disorder. So in the wintertime, actually the snow is reflecting the light, which makes things a little bit brighter, so that can be helpful for some people. So what are some of the symptoms? Feeling tired, depressed, decreased activity, depression, crying spells, fatigue, irritability, trouble concentrating, body aches, loss of sex drive, poor sleep, insomnia, overeating, especially for carbohydrates, and weight gain. Know the signs. The symptoms of seasonal affective disorder typically tend to begin in the fall of each year, lasting until spring. So the symptoms are more intense during the darkest months, like January, February, and maybe March. Therefore, the more common months of symptoms will vary depending on how far away from the equator one lives. Summer symptoms can include loss of appetite and weight loss. In severe instances, thoughts of suicide can actually occur. What causes it? Seasonal affective disorder seems to develop from inadequate bright light during the winter months. Researchers have found that bright light changes the chemicals in the brain. Exactly how this occurs and the details of its effects are being studied. Low light and darkness trigger melatonin production, making us tired. Factors like low vitamin D levels in the blood are also found to be associated with a higher occurrence of seasonal affective disorder and some other depressive disorders. As you know, we naturally get vitamin D from sunlight, which is changed in our skin to vitamin D. So taking vitamin D supplements throughout the winter month can be very helpful. What can you do? Maximize your exposure to daylight. Make your house brighter. Trim the bushes around the windows. Keep your blinds and curtains open during the day in the wintertime. Use bright colors on the walls and light-colored upholstery. Get up early to take advantage of as much daylight as possible. And if possible, sit near a window at work. Getting outside every day during the middle of the day is beneficial to get the most light. And use full spectrum light bulbs or fluorescent lights in your house. Engage in activities that you enjoy. Take some time off in the winter. Instead of using all your vacation time during the summer, go on vacation to a warmer, sunny climate during winter for a refreshing break. I used to love to do this when I lived in Vermont. In January, I would go away for 2 weeks for my spiritual retreat. Volunteer or participate in activities that make you happy. Spend some time with family and friends who are caring, supportive, and positive. Commit this to memory. Experiencing pleasure is crucial for vibrant health. It is not selfish, it's a gift to yourself and the people around you. Your joy creates an ever-broadening circle of celebration and joy that spreads out from you in waves, lifting up everyone. This is from Dr. Christiane Northrup. Practice healthy habits. Exercise daily to increase your oxygen intake, improves your mood. Get enough sleep. Eat a well-balanced, healthy diet of fresh foods, vegetables, as well as fruits, and reduce your stress. Spend time outdoors if possible. Skiing or outside walking is an excellent way to get lots of light and exercise in the wintertime. Practice good sleep habits and take time to relax before bed. Eat healthy foods for more energy and limit your caffeine. Stop eating crap, such as carbonated beverages, refined sugars, artificial foods, and processed foods. These will bring your energy vibration down, basically, and bring you into a more depressed state more rapidly. Here's some stress-reducing foods that you can encourage. Lots of fruits and vegetables, beans, nuts, and seeds, berries. All different kinds of berries are excellent. Radishes, coconuts, yellow vegetables such as carrots and squash, as well as fresh fish like salmon. Reduce your stress. Stress affects the body, the mind, the emotions, and the behavior. If you look at physically, stress might create headaches, frequent infections, tight muscles, muscular twitches, fatigue, skin irritations, and breathlessness. Mentally, you can have more worrying, muddled thinking, impaired judgment, nightmares, indecision, negativity, and hasty decisions. On an emotional level, you might find a loss of confidence, being more fussy, irritable, depressed, apathy, alienation, and apprehension. And behavior-wise, you might find you're more accident-prone, loss of appetite, loss of sex drive, drinking more, insomnia, restlessness, and smoking more. So reducing your stress is essential, making sure you manage your stress well. Do some deep breathing. Get into the habit of remembering to relax and take several deep conscious breaths into your belly. It immediately relaxes your stress and improves your mood. Good nutrients can also help, like a good B-complex vitamin daily is essential to keep your mood balanced throughout the month, and it also helps you deal with stressors better and stay more balanced. Omega oils, which are essential fatty acids like flaxseed oil, fish oil, krill, or perilla oil, are also essential. Vitamin D3, doses of 5,000 to 10,000 units a day are essential, especially in the winter months. Magnesium before bed also helps to calm and relax. This is just a picture of one of the vitamin supplements that I highly recommend for people. It's called Alive Whole Food Energizer. It's a liquid multivitamin mineral with greens and vitamin D3 and mushrooms and all kinds of nutrients. So sometimes it's very easy to just take 1 ounce of that in water every day. Take all your medications as directed. Talk to your healthcare provider about prescription or over-the-counter drugs and diet supplements, including vitamin D, as well as any herbs you take. Follow directions carefully and watch for interactions and side effects. Avoid alcohol and recreational drugs, and avoid caffeine and energy drinks especially. Consider light therapy. There are several devices available, from battery-powered visors, portable light boxes, and special light bulbs to LED light systems and dawn simulators, lamps that switch on before dawn and gradually light your room, just like the sun rising. According to Dr. John Ott, he was a pioneer in the light therapy field. In 1973, he wrote a book called Health and Light. He said, "We are all light deficient, and this deficiency may be the source of our physical and emotional problems." Light treatment is also called phototherapy. In addition to being the key to prevention of seasonal affective disorder, regular exposure to light that is bright, particularly fluorescent lights or blue LEDs, significantly improves depression in people with this disorder when it presents during the fall and winter months. And just as a note, blue LEDs have a different spectrum of light than looking at a computer screen or a cell phone or a tablet screen. Has more of a grayer blue spectrum, which is actually not beneficial to the body in the evening. So the blue LEDs are actually a little bit more toward the yellow spectrum and can be more calming and beneficial. The light treatment that's used daily in the morning and evening is used for best results. Temporarily changing locations to a climate that is characterized by bright light, such as the Caribbean, or anywhere closer to the equator can have similar results. Individuals that suffer from seasonal affective disorder also will likely benefit from increased social support during vulnerable times of the year. So think about the fact that we are what we consider blue sky people. When we go outside on a sunny, clear blue sky, it's hard to not be happy and to really enjoy that. It energizes us. When there's gray, overcast clouds during the day and we're not seeing that blue light, we can have a tendency to be a little bit more depressed. Phototherapy or light boxes can be used. They're commercially available in the form of light boxes, and they're used for approximately 30 minutes a day. The light required must be of sufficient brightness, approximately 25 times as bright as a normal living room light. Contrary to prior theories, the light does not need to be actual daylight from the sun. It seems that it's the quantity, not necessarily the quality of light, that matters in the light therapy of seasonal affective disorder. Light therapy in the form of LED pads is also an excellent option. This is a powerful, effective, safe, and affordable technology that's revolutionizing medical treatment for pain, many neurological disorders, and musculoskeletal and soft tissue maladies. Quantum healing with light photons is poised to become mainstream in medical practice in the future. Photonic stimulation, or light therapy, is actually a powerful, effective, safe, and affordable technology. It's revolutionizing medical treatment for pain, many neurological disorders, including S.A.D, and a wide variety of musculoskeletal and soft tissue things. Quantum healing with light photons is poised to become mainstream in medical practice. According to studies, many benefits of light therapy are: it reduces your pain, restores sensation, supports the immune system, strengthens the immune system, speeds up wound healing, prevents amputations, speeds up fracture, tendon, and bone healing, creates new blood and lymphatic vessels, relaxes the stress response in the nervous system. LED light therapy is also used to treat seasonal affective disorder, neonatal jaundice, and insomnia. So what does light therapy do? It increases the ATP production as much as 150%. ATP, which is adenosine triphosphate, is really the kind of like the cellular engines in your mitochondria that produce energy for you. So it increases your energy production. Stimulates tissue granulation and connective tissue projections, which means it helps the repair process. It speeds up the repair process. Stimulates acetylcholine release, which is a neurotransmitter which relaxes the excitability of the nerves, reduces the excitability of nerve tissue, decreases pain and numbness in extremities, and reduces inflammation. Here we see a picture of the UV spectrum all the way to the red or infrared spectrum. Basically, this is the only spectrum of light that we can see with our physical eyes. We only see a small slice, like 2% of the whole light spectrum. Anything above the violet light here becomes UV light that we don't see, as well as infrared. Beyond the red spectrum, we don't see near infrared or far infrared light, and then there's more beyond that. Plus, light therapy stimulates nitric oxide production in the body. It increases the body's vibration, enhances cell communication. It activates a whole pharmacopoeia of the brain and glands, which means it's activating all the neurotransmitters and hormones that the brains and the glands produce. Supports the release of hormones, de-stresses the adrenals, the nervous system, the entire body, and shifts cellular polarity. It's very effective for ordering and structuring the cellular water fluid in the body. Using light therapy for your family, light therapy today is quickly becoming a home health device. It can easily be used for the entire family or in a clinical setting to assist the body in returning to a state of balance or homeostasis. Athletes prefer to use light therapy to recover from injuries 44% faster. Light and frequencies allow us to recover from stress much more thoroughly and rebalance the body. Watch for early signs if S.A.D is getting worse. If you suffer from severe winter depression, consult a psychologist or a psychiatrist. A qualified healthcare provider can help determine if your symptoms are related to S.A.D or may have another cause. Additional treatments available include psychotherapy, behavioral therapy, stress management techniques, and possibly antidepressants if necessary. Acupuncture may be another viable alternative intervention to antidepressant medicines, particularly in pregnant women for whom medications should be used with caution. So get into the light. We all thrive when we're in the light. And again, my name is Jane Smolnick. I'm a naturopath and iridologist. You may visit my website at ultimatehealing.com or solusacademy.org for more information. Thank you. I hope you enjoyed this presentation.